Our next presentation is from Dr. Chidi Jaja. He is an associate professor and assistant dean for global engagement in the College of Nursing at the University of South Florida. His interests in social justice, health disparities, and improving health outcomes in historically marginalized and vulnerable populations, such as those with sickle cell disease, drives his research, clinical, and advocacy initiatives. He has received national recognition for his research contribution, as evidenced by being selected as a 2016 NIH Future Research Leader, a 2018 Fulbright Program Scholar, and a Fellow of the American Academy of Nursing in 2021. He will talk to us today about his professional partnerships and research initiatives in the West African nation of Sierra Leone. Thank you, Dr. Jaja.
Thank you, Dr. Yvonne Carroll. Good morning, good afternoon, and good day to wherever you are in the world. I'm Chidi Jaja, and I am speaking to you from Tampa, Florida. And I'm delighted to be here to talk about something that I'm very, very passionate about, and that is sickle cell disease. I have no potential conflict of interest or financial interest to disclose other than the fact that some of my friends are nurses, and I am thrilled to be here. Okay. So as for my agenda, what I want to talk about is basically to make a case that nurses are just awesome individuals, okay? And I say awesome by virtue of the fact that not only do we have a year, 2020, to celebrate our accomplishment and achievement, but also to showcase and highlight the kind of work that nurses could be engaged in to advance healthcare across the world. Okay. So my talk today is focused on how nurses could be in charge and champion major health initiatives in parts of the world where resources are very limited in the context of managing patients with sickle cell disease. I'm sure a lot of folks in the audience have seen this graph before, okay? But its symbolism or its significance, is in the fact that sickle cell disease is a global disease. But the burden of the disease, as you can see from this chart or this graphic, is that it is concentrated outside the United States, namely in sub-Saharan Africa. To put things in context, or to show how the burden of sickle cell disease heavily impacts folks in Africa, in the United States, each year approximately 2,000 babies are born with sickle cell disease. But we project that in sub-Saharan Africa, roughly about 3,000 babies are born with sickle cell disease. And if you do the calculation, that translates to about 1,000 births a day, 1,000 births of sickle cell kids a day in Africa. And this is really a tremendous figure, okay? But much more concerning is the fact that when you look at the lifespan of patients with sickle cell disease in different parts of the world, what is concerning is that children with sickle cell disease have a much more minimal opportunity to exercise or live their life chances. What do I mean by this? Okay, as you can see from this chart, whereas in the United States, kids born with sickle cell disease have a 94% chance of making it to adulthood. In many parts of Africa, kids born with sickle cell disease are given a ticking clock at birth, and often most of these kids have less than a 10% chance of making it beyond their 5th birthday. So as a nurse, I believe that we have a role to play in advancing the well-being and healthcare of individuals with sickle cell disease. And I was delighted when last year, actually in 2021, the National Academy of Medicine came up with a roadmap for nursing. And central to the roadmap is the notion that as nurses, we have an obligation to advance equity in healthcare. And I'm also thrilled that as NAPA has used this banner as the main theme for our conference this year. Okay. I'm somebody who subscribes to the notion that as nurses, our obligation is global. Okay. Our obligation is global. And that's to say, we have to be trained to see our responsibility beyond as transcending our local environment. Okay. We have to see ourselves as individuals who have a mandate to care for patients, regardless of their geographic origin, regardless of their race, ethnicity, and so forth. Okay. We have a mandate to exercise and spread equity within our healthcare system or within the healthcare system. And that has been the driving factor in the work that we've been doing in Sierra Leone over the last 7 years. So essentially my talk is about the kind of work that a team of nurses and other clinicians have been able to establish in a tiny country in West Africa called Sierra Leone. Okay, so just in case you don't know where Sierra Leone is, it's on the west coast of Africa. And I often tell people when I talk about Sierra Leone that it is indeed a paradise. And I want to urge you before you die, please make it a point of duty to come to this beautiful country. Okay. But even though it's such a beautiful country, in the last 30 some years, it has experienced a number of problems that has created havoc, in the healthcare system. So for example, in the 90s, the country went through 10 years of very brutal civil war. So if you've seen the movie, The Blood Diamond, it gives you a depiction of the wars that the country experienced, in the 90s. And then recently, in 2014 to 2016, it was one of 3 countries in West Africa that experienced the Ebola epidemic. And I cannot even begin to tell you the impact of Ebola. So about 30,000 individuals died, from Ebola across the 3 countries in West Africa that were impacted. But the impact of the healthcare system was even worse. A lot of doctors and nurses died as a result of caring for patients with Ebola in Sierra Leone. So what that means right now is that the healthcare system is still trying to recover, and it is very, very fragile. Okay. So a little bit about Sierra Leone in the context of sickle cell disease. It's a country of about 7 million people, very small, but in terms of sickle cell disease burden, we estimate that that Sierra Leone ranked between the 7th and 9th highest in terms of the highest number of sickle cell births annually in sub-Saharan Africa. So to put this in terms of stat figures, between 4,000 to 5,000 babies are born with sickle cell disease annually in Sierra Leone. But approximately 90% of these kids will not survive beyond their 5th birthday. They will die without even being diagnosed of sickle cell disease. They will die because they're susceptible to malaria, infection, sepsis, and so forth. Okay. And part of the reason is because, again, as I mentioned, the fragile healthcare system and limited resources, there are no standardized or universal program in the country to manage individuals with sickle cell disease. And it's not like the government of Sierra Leone is not aware that sickle cell disease is a major problem. It is, As a matter of fact, the government actually published a white paper about 3-4 years ago kind of like map out the plan in terms of how the country would address sickle cell disease. So there are plans for newborn screening, there are plans to build clinics, there are plans to train nurses. But like many developing third world countries, the number of issues that the government has to deal with are overwhelming, and there are limited resources. So even though there's a roadmap, there's a white paper in terms of how the government can go about addressing sickle cell disease, there are hardly any resources. And so what are left is for individuals or for individuals to come up to emerge as champion for sickle cell disease. And I think that's a mantle that we've readily accepted in Sierra Leone over the last 6 years. Okay. So we've established a project called the Sierra Leone Sickle Cell Disease Project. And our partners are universities in the United States, a patient advocacy group in Sierra, well, several patient advocacy group in Sierra Leone, and a federally qualified healthcare center based in Buffalo, New York, called Jericho Road. I'll talk more about Jericho Road later on. But so these are our partner, and together we came up with an agenda in terms of how we can advance sickle cell disease in the country. Okay. And specifically, we want to demonstrate that you could actually create a clinical program to manage individuals with sickle cell disease. We also want to demonstrate that you could actually put in place training infrastructure that would prepare a cadre of nurses, doctors, and other healthcare workers to manage individuals with sickle cell disease. We also know that because of geography and access to healthcare resources, the way sickle cell present will vary across different geographic regions. So we also want to be involved in a research project that will study the natural history of sickle cell disease. That is to study how sickle cell disease presents itself in the United States and in Sierra Leone. Mainly, we want to understand how access to healthcare, how access to resources could impact how sickle cell disease is manifested. And so that's the goal of the Sierra Leone Sickle Cell Disease Project. Okay. So I mentioned that in Sierra Leone, kids born with sickle cell disease have a very high probability of not making it past their 5th birthday. And part of the reason why this is the case is because kids with sickle cell disease are not screened at birth. And this is largely due to the fact that the infrastructure, the lab technology that are required for universal newborn screening are not available. They're very expensive. They require a lot of resources. And if you've been following my presentation, the government does not readily have the means to provide this type of infrastructure. Okay. So a lot of kids, born with sickle cell disease, and they and the parent don't know that they have the disease until they start manifesting the comorbidities that are associated with the disease. Okay. But the good news is that you really don't need large laboratory infrastructure to manage sickle cell disease. There are now commercially available point of care testing that are very cheap, and they could be used by anybody with very minimal training. And two of the kits that are now available is the Hemotype SC and the Sickle Scan kit. Okay. And they're really very easy to use. As you can see from this graphic, all you need is a tiny drop of blood, and the processes will vary based on the test that you use. But at the end of the day, these tests can tell you within a short period of time, ranging from between 3 to 5 minutes, they could tell you whether you have your a genotype, or you have AS, which is a trait, or sickle cell disease, or other variant of sickle cell disease. And so the issue now in many developing countries is no longer technological. We don't need large laboratory infrastructure to identify kids with sickle cell disease. And so that's the good news for countries like Sierra Leone. Okay. And because we are researchers, myself and my colleagues have done what we call a systematic reviews of how these tests have been used in different parts of the world. And we concluded that these tests have the technical characteristics, that that makes them comparable to the large, laboratory infrastructure that are typically used for sickle cell disease diagnosis. And so I mentioned earlier that our program in Sierra Leone is to develop a structure for wellness care, to train healthcare workers to care for sickle cell disease, and to research, how sickle cell disease manifests itself, in individuals with the condition. But we believe that the way to go to do this, is not to do it. It's not the go it alone approach. We need partners. We need to develop strategic relationship, and we also need to leverage resources and opportunities wherever they are available. And so our first partnership that we developed was with one of the manufacturers of one of the tests that I mentioned about, the Sickle scan. And this company is called Biomedomate, based here in the United States. And our first partnership with them was to do a t-shirt sale drive, whereby proceeds from selling the t-shirt could be used to purchase the Sickle scan kit, which would then use to test the individuals with the disease in Sierra Leone. And I'm happy to say that that campaign was very successful. And as a result, we were able to acquire from Biomedics, a large number of test kits that we use to perform screening in the community to identify actually children with sickle cell disease. So here is me and one of my partners, Dr. Stephanie Ibimare in Sierra Leone, in one of our community outreach. Another partnership that we were able to develop was with the United Nations. United Nations has an organization called the International Organization for Migration. And so we made an outreach to them to see if they could provide us funds that we could use to do a pilot newborn screening in a major hospital in Sierra Leone. And so we received about $30,000 from IOM. And with that resource, we're able to do screening over a 3-month period in a very rural part of Sierra Leone, a very rural hospital. And this is one of my best slides ever, because what we're seeing here are children who are the first set of kids, in the history of Sierra Leone to be screened at birth within 24 hours, to see if they have sickle cell disease or not, using point of care screening. And so these kids forever will be my heroes, okay? So once we're able to demonstrate that it is easy to screen and identify individuals with sickle cell disease, our next role is to do what we said we're going to do, which is basically to start establishing a clinical care program. And to do so, we partnered with a US-based healthcare system in Buffalo called Jericho. It's actually a federally qualified healthcare center. But what is so amazing about this healthcare center is that they have a global outreach program. And what do I mean by this? Well, Jericho Road has, in different parts of the world, Sierra Leone being one of the countries, they have established a very large community health center. And so we partner with Jericho Road to see if we could use their center as our medical home, where we could establish a clinic. And so in July of 2017, we established the first pediatric clinic in Sierra Leone with a cohort of about 120 children. Okay? And what is required for this kid is that they have to present at the clinic once a month for comprehensive wellness check, which will take about 45 minutes. And we also provide them with or their parent with education about sickle cell disease. And then so your basic medication, Penvicate, folic acid, and so forth. Okay. And in this slide, the kid, this was our first patient, and you can see how terrified she is, was here because of the work we're doing. You can see as here is you with my colleague, Dr. Ibimare, and she's striving. She's really striving. Okay. This is what the pediatric clinic looks like. So this is the what's look like from outside, and this is the waiting room and various facets of the clinic. It is still, very rudimentary, but based on the area of part of the world where we work, we believe it's adequate. Okay. When we started the clinic, we see presentation in a patient that you would not see, here in the United States at all, and that's because here in the United States, this kind of presentation, are unlikely to emerge because of access to care very early on in life. So to the stomach caused by enlarged spleen, the dactylitis, the ulcers, so these are the presentation that we notice in our patients, largely because they didn't have access to specialty care. Okay. But over time, as we provide support for these children, we can see that they're thriving. I also love the slide. I really do love the slide. So these are patients, and they look so healthy. They now believe that they could approach life, just like any other kids. All that they have is a chronic condition and not a death sentence. And they are wearing my stethoscope simply because I made them made a solemn promise to me that they're all going to be doctors and nurses and take care of sickle cell kids or patients when they grow up. Okay, so and that's a promise I'm going to hold them to. This is exciting time. This is really exciting times, for sickle cell disease. So for folks who manage kids with sickle cell disease, you understand immediately what the slide means. Okay, so basically, at this point in time, our knowledge of sickle cell disease has expanded greatly. We know so much about the disease. We know how it affects the different organ systems. More importantly, because of this knowledge, we're now beginning to see new drugs on the market. And there's also new clinical guidelines being prescribed or developed in terms of how we could go about managing individuals with sickle cell disease. Okay. So what this means is that globally, there's opportunities for us to make the lives of patients with sickle cell disease a lot better. Okay. And this is where I believe as nurses, and based on our humanistic values, that we adopt, especially the value of equity, we now have an obligation to make sure that we are of service to individuals, with conditions like sickle cell disease, wherever, they present. Okay. And so what we want to do in Sierra Leone is to develop the healthcare system, or basically to use sickle cell disease as the vehicle that we could use to go about strengthening the healthcare system. Okay, but we want to do it in a way that is feasible, that is acceptable, and can be reproduced. So for that reason, we're using a scientific approach. We're using a framework called implementation science. And in terms of who is going to lead this intervention, we believe that nurses are uniquely positioned to do this type of work. So what we're trying to develop in Sierra Leone are nurse champions who could actually take leadership, not only in clinical care, but in research and also in policy development. Okay. But to do so, to be able to do so, we need to have partners who could join us in supporting the training and education of clinicians, nurses who will be caring for sickle cell disease. And I am happy to say that ASCANAPA is a trailblazer. So this slide on my right-hand side, these are members of ASCANAPA who have, over the last year or so, developed a sickle cell clinician curriculum that they're poised, I think, in April to start training nurses, from different parts of the world, from within the United States and different parts of the world, to how to manage individuals with sickle cell disease. And I'm happy to say that one of my staff, one of my sickle cell nurses in Sierra Leone, is going to come to St. Jude's Hospital in April to be part of this inaugural training program. So I am thankful to ASCANAPA as a partner in terms of helping us come up with a curriculum that would be used to train individuals in sickle cell, in Sierra Leone and other part of the world to manage patients with sickle cell disease. Okay. The challenge in a country like Sierra Leone and many parts of the world, where resources are limited, is early screening. Okay. The sooner we could capture individual or kids with sickle cell disease, the sooner we're able to make a difference in their life chances. So with this in mind, we have been very, very deliberate, in terms of looking for partners or resources that we could use to make this happen. So in 2021, I was happy to say that after several grant submission to the NIH, we're able to be funded by the NIH to actually do newborn screening in Sierra Leone over a three-year period, whereby we could train nurses how to diagnose kids with sickle cell disease within 24 hours of birth and over 28 days of birth, to diagnose them with sickle cell disease or to check whether they have sickle cell disease or sickle cell trait using point of care testing. And this program, we started this program late last year. Okay. But that's not all. Okay. We also realized that in a country like Sierra Leone, there is so much misinformation about sickle cell disease, and there's so much stigma. Okay. And so what we want to do again is to put in to educate the community about sickle cell traits, to educate them about sickle cell disease, and to educate individuals with traits about the consequences and help them make informed reproductive choices of decision making. And to do so, we actually submitted another grant proposal to NIH, whereby we proposed to train nurses how to do genetic counseling and then screen individuals for sickle cell trait in one clinical visit. And again, I'm happy to say that last year, this project was approved for funding by the NIH, and we're actually just getting ready to commence the screening program. Okay. But that's not all we're doing in Sierra Leone. We believe that not only do you have to screen individuals to determine if they have sickle cell disease or not, but not only do you have to educate or sensitize the community about sickle cell trait and the reproductive implication, but once you identify individuals with sickle cell disease, you also need to put in a structure whereby you can start to care for them across the lifespan. So I'm happy to say that we recently received support from the pharma company, Pharma Therapeutics, which recently got bought over by Novo Nordisk. And Pharma Therapeutics is providing us funds over a two-year period to establish 3 new sickle cell clinics in Sierra Leone that are going to be run by or managed by Nurse Champion. And this program is commenced to start later this year. Okay. So there's really so much work that needs to be done for sickle cell disease. Okay. If we're to give these kids life chances, if we're going to make an improvement in their life, there's so much work to do. And this work cannot be done by one group alone. So for this reason, we are always seeking partners and looking for opportunities. So I want to take this opportunity to ask, folks in the audience, if this kind of work is of interest to you, to join our cause in Sierra Leone. We have actually come a long way. We come a long way from not having any established office. This is going to be our new office in Freetown. And like I said, our mandate is to use our role as nurses to advance equity and improve healthcare so that everybody can live a dignified life in Sierra Leone. So if you're interested in our cause, we look forward to you joining us in doing this important work. Okay, and thank you, and I can take questions.
Thank you so much, Dr. Jada. I love it. Great work, and I love that you're always recruiting. So we have a couple of questions. When do children tend to get diagnosed? 6 months or later with dactylitis in Sierra Leone?
Well, so it's funny though, because dactylitis typically is a manifestation of a sickle cell crisis that might manifest itself in children. But what we see though is that in small children, something as simple as infection, could trigger dactylitis. Okay, so really, I cannot put a time frame. Okay, I cannot put a time frame, but like I said, the presentation is different in Sierra Leone from what I've seen clinically here in this part of the world. In fact, it's very rare to see dactylitis here in the United States.
Right. If a family has multiple children and one has sickle cell disease, is there additional support for monitoring done for, I'm guessing they're asking about for other siblings?
Well, I'm not sure I understand the question. Are we talking about support for kids without sickle cell disease or kids with sickle cell trait?
I'm guessing that this is just me. That's all I had. But I'm guessing they're asking if you have one child that's diagnosed on newborn screening, well, when at a newborn age, do you screen the rest of the children in the family for sickle cell disease?
Okay, so again, the project that we're involved in are basically a pilot project at this point in time. Okay, so initially we tried to determine if the kit that we're using can actually diagnose sickle cell disease, both in children and in adolescent and adult. That we were able to prove. And then the second task was, well, can we use newborn screening out in the community and also in the clinical setting, and that we're able to do. Okay, so what is needed now moving forward is a system of screening every kid at birth. Okay, but that takes resources, and that's where it's important for us to have other partners join us in this quest.
Great, and I think this will be the last one. Do we have a hand raised? Okay, I thought we had a hand.
Yes, we do.
Oh, okay. Karen Fleming.
Thank you. Thank you so much for allowing me to unmute. Dr. Jaja, you are so inspiring. As a fellow nurse, I enjoyed listening to everything you talked about. The work you're doing is so meaningful. So thank you very much for sharing all that. I posed a question. I'm in Toronto, and someone else had kind of posed the same type of question. They're in the US. Is there a way to support, as a healthcare provider from Toronto, and then I'm also a part of a patient advocacy group, so I'll reach out to you from that perspective. We would love to partner with you from that way. But I just wanted to see, how can we partner?
And I can connect you to afterwards and give you an exchange email.
We'll look forward to partner with anybody who wants to help us with the work we're doing in Sierra Leone.
Great. So thank you again. We did have a question about the scholarship earlier. Someone asked if it's for undergraduates as well. And yes, it's for anybody in post-secondary education, only in the United States, though. Unfortunately, we don't have the capacity to verify college outside of the United States. So for undergraduate and graduate school. And so Dr. Jaja, thank you so much. You're doing, I love you. The work you do is fantastic.